I'm just back from San Francisco, where I've been attending the first Digital Orthopaedics Health Conference. This was held by UCSF and was held in San Francisco the same week that JP Morgan had their big health innovation conference. The event was a great opportunity to represent ORI on a global stage. We were the only representatives from the UK amongst a range of different delegates spanning orthopaedic surgery, the IT and tech industry, and also implant and orthopaedic industry manufacturers. I had the opportunity to follow up on conversations and meet with a number of potential collaborators. The big players such as Zimmer Biomet, Stryker, Depuis, along with big players in the IT field such as Google, Nokia Technologies, and other telecommunications companies. Orthopaedics is a great place for digital health technologies. That's because in general we've got a well population who are in the main part young in comparison to other medical specialties. Also, orthopaedics happens in an acute care facility where it's easy to deploy these new systems and new digital health interventions and techniques. And the other advantage is that it's largely transactional. We have a short episode of care. Patients come in for their operation, they go through their rehabilitation, and then they rejoin society without any further ongoing need for digital health solutions. So what did I learn? Well, I learned that digital health is the future in orthopaedics, and our work here at ORI is absolutely on the right track. Solutions such as virtual reality, augmented reality will become commonplace and replace traditional training and educational techniques for surgery. That's why our projects looking at virtual reality are so important, and we are in a really good place to take our learning to an international market, both with the providers of orthopaedic implants, but also the technology providers developing these techniques. Other areas of interest are things like big data and artificial intelligence. And again, our work at pathway redesign with enhanced recovery after surgery and our work looking at big data sets looking at national outcomes are setting us on the path to working further in this area. We need to find partners who we can work with to analyse these big data sets and so that we can take our learnings to predict and prevent disease in our patients in the future. Another area that was a big theme of the conference was the use of technology to orchestrate and improve care pathways. This feeds into a core expertise within ORI around enhanced recovery after surgery. There's no point deploying pathway solutions that help to manage pathways unless you've got an evidence-based standardised pathway delivering good results in the outset. And that's what enhanced recovery is. So that's another area where ORI is ideally placed. And the final area where there is a growing use of technology is the collection of patient-reported outcome measures and the monitoring of rehabilitation post-discharge from hospital. It's a big area of interest both in the UK and the United States. We want to prevent readmissions, we want to prevent complications, and we want to provide enhanced rehabilitation for our patients through solutions such as telemedicine, apps on our phone, and tutorials online. Again, this is an area that ORI is already researching and already using monitors that can track patients' activity and also movement in the home environment. And we've also got the lab technology with the Primus and the Grail so that we can validate these remote techniques against more traditional techniques. So in summary, it was a great conference, truly inspiring to go to the Bay Area in San Francisco. If you're going to look at technology, that's the place to go. As a representative from the UK, it also put ORI in a unique position. There were no other academic institutions represented from the UK or in fact Europe. And so we're definitely ahead of the curve, and we will be attending the conference next year. It also opens up the possibility for what we can do in the United Kingdom and whether we should examine running our own conference, collaborating event or Kickstarter event later this year. And those are plans that we'll be looking into.